Good morning, everybody. My name is Lei Chai. As Roger mentioned, I'm a physician. I see patients at Brigham and Women's Hospital, Dana-Farber Children's Hospital, as well as a principal of investigator with the Department of Pathology at Brigham and Women's Hospital. So today, I'm going to talk about a novel mechanism and compound targeting oncofetal transcription factor cell 4 in cancer. So, as a physician, I'm always caring about the main problem we're facing for cancer patients. What is the problem? The problem is, despite years of progress, every year we still have nearly 10 million patients dying from this disease. This is heartbreaking to me. So clearly, we need a better approach. So what is left there that we're not targeting? Today, I'm going to talk about targeting transcription factor, which historically been viewed as untargetable area. Hopefully, as a novel therapy going forward, we can change the situation. So what is a transcription factor? A transcription factor is a DNA binding protein. It's in the nucleus. It may form in complexes. It is a master regulator that can turn on and off hundreds, if not thousands, of downstream targeting genes. So by doing so, you can imagine that's why transcription factors are drivers of cancers, and it's the best candidate. We just haven't quite figured out approach yet. So how do we do that? So I hope in the next few slides, I can walk you through using cell 4 and a target that we have been working on in the last 20 years as an example to see we actually can use this approach to targeting cancer, particular solid tumors. So as you've seen on the left side, back in 2013, almost 10 years ago, we already had our paper from New England Journal of Medicine talking about this particular transcription factor cell 4. This is a gene, it's very unique. It's expressed naturally in fetal tissue. In this case, it's fetal liver, and then get silenced after birth, so you don't really see in adult liver. However, it's reactivated or re-expressed in 55% of liver cancer patients we observed. That's where it gets the name fetal oncoprotein. It turned out it's not just in liver cancer. In almost all cancers, about 1/3 of all cancers, that cell 4 is upregulated, as indicated in the red dots, and with the minimal expression, as indicated in blue, in the normal adjacent tissue on this right panel. This is from TCGA. So is cell 4 just a biomarker for cancer, or it actually has a functioning role? So in exploring that idea, we use gain of function study where we overexpression cell 4 in a murine or mouse model, where we see these mice develop liver cancer and blood cancers over time. What about loss of function? We also knock down cell 4 in a tissue-specific manner in mice, where we observed these mice are resistant to induce tumor formation. In data I'm not showing here due to the time limit, we also did that with cancer patient-derived samples where we knock down cell 4 and then doing a xenotransplant in the mice that we observed impairment of tumor formation. So it's really a driver for cancer. How does cell 4 do it? Through the years, now lab and now collaborator shows that as a transcription factor, it turns on and off many genes, including the famous c-MYC genes as oncogene, activation of MYC, as well as repression tumor suppressors such as PTEN along the AKT pathway. So by doing so, cell 4 contributes to cancer's cell development and progression. So we next select a disease model where we use liver cancer or HCC as a model. Why we choose liver cancer? Because this is a disease has high incidence globally. However, in US, because it's a rare incidence, it actually fits orphan disease status. We're hoping by doing so, we can fast track once we have a compound. This is also a disease has very high mortality rate. The incident to mortality ratio almost 1-to-1. Why is that? Just because we don't have an effective treatment. So current therapies, including chemotherapy, very limited targeted therapy treatment. Most recently, immunotherapy have been tried, but it only extends the patient's lifespan 2 to 9 months. So because of this, for years, we have studied SALL4 using liver cancer models, so we know a lot about its function, structure, mechanism, as well as targeting. And then again, we've seen SALL4 up in 55% in liver cancer patients. So how do we do this? For the audience, some of you may know this. For proteins, we now actually have a protein degradation approach. And I'm just going to be simplified about the mechanism and compound we're finding, and I can answer the question during Q&A session outside. So we found a compound called CP1, which is a non-IMiD small molecule degrader. So CP1 can bind to SALL4, recruit the E3 ubiquitin ligase complex. By doing so, it directs SALL4 to this 20S proteins complex where SALL4 being shredded into pieces. This leads to loss of SALL4 expression in these cells, where it triggers apoptosis of cancer cells and inhibition of tumor growth. We further confirm CP1 is a good target, showing good in vivo efficacy by having a liver cancer xenotransplant model where we implant the liver cancer cells subcutaneous in the immunocompromised, and then once we see tumors start to grow, we start to treat these mice with the CP1. Here just showing that with different dose, as little as 2.5 milligram per kilogram, we can significantly inhibit tumor growth. We have been following these mice for a while. So far, we haven't seen any toxicity. So in summary, I hope I have concluded and showed you that we found a very targetable and a very exciting transcription oncogenic factor SALL4. It is detected in 1/3 of all tumors, and it has very minimal expression in normal tissue, which we are hoping that could limit its off-target effects. And SALL4 is a driver for cancer formation. We have developed a novel class of a non-IMiD degrader with IP protected. We're going to use liver cancer as our lead indication with the potential expanded to many other solid tumors. We're seeking for 5 million for the next step to form and launch a new co and partner with the people who has interest. By doing so, we want to complete preclinical IND enabling study for our lead compound using liver cancer as first indication. In the meantime, we're going to develop a companion diagnostic tool for SALL4, which already have quite a bit of data on that. We're hoping to do proof of concept to extend it to the next indication, which is the lung cancer. Thank you for your attention.